fully vaccinated people need to continue to take precautions such as masking and social distancing when in public, when visiting with unvaccinated people from multiple other households, and when around unvaccinated people who are at high risk of getting severely ill from COVID-19. The new guidance is based on the latest science, and it is a step forward. As we continue to learn more about how well COVID-19 vaccines work, we will continue to update our guidance. The vast majority of people need to be fully vaccinated in Minnesota before COVID-19 precautions can be lifted. I also wanted to give you an update on what's happening in Carver County. On Friday evening, we shared our concerns about a rapidly growing outbreak of B.1.1.7 variant COVID-19 in Carver County. And today we have some updates to provide on that front. 27 cases of variant COVID-19 are associated with the outbreak. Not all live in Carver, but they all are linked to activities there. Since late January, at least 84 cases of COVID-19 have been linked to participants in both school-sponsored and club sports activities, including hockey, wrestling, basketball, alpine skiing, and other sports. In addition, we have seen increases in cases in Carver County gyms and fitness centers, with many of the cases linked to the sports-related cases. MDH has observed a concerning increase in the rate of growth of cases in Carver County over the past month, a 62% increase between the week of beginning January 27th to the week beginning February 24th. Case rates in Carver County are now approaching rates seen in October 2020, and a high proportion, 35%, are under age 20. Today, we also announced a new temporary COVID-19 testing site at the Chanhassen Recreation Center. Testing at the site will occur Thursday, March 11th through Saturday, March 13th, and Thursday, March 18th through Saturday, March 20th. Appointments are encouraged but not required. The variant circulating now presents added risk that we may see another surge in cases, and we need everyone to do their part to prevent that from happening. When combined with social distancing, masking, avoiding crowds, and staying home when sick, testing can help us slow the spread of COVID-19 while we work tirelessly to get as many Minnesotans as we can vaccinated. Testing is a key part of this response effort. The sooner we identify positive cases, the sooner infected people can take steps to isolate and stop the spread of the virus. People can take control of this situation by getting tested, masking, and limiting social interactions. The Chanhassen testing site is a coordinated effort between the state of Minnesota, the Minnesota National Guard, Carver County, the city of Chanhassen, Chanhassen Recreation Center, and Vault Health. As with all of the state's community testing sites, testing at the site is offered at no cost. You can find more details in our news release from this morning and online. A few points of context here. This concern about variant spreading isn't confined to Carver County. We have detected cases in 15 counties in Minnesota, so we urge all Minnesotans to follow prevention measures carefully so that we do not end up having another surge in cases. We are making progress with vaccination, but it's a race against time as most of the population is not yet vaccinated. We know people are tired of COVID mitigation measures. We are too, but the next number of months are going to be challenging to prevent a surge in cases, hospitalizations, and death. Thank you, and with that, I'll turn it back to Mike Schomer.
Thanks, Chris. Operator, we're ready to take questions.
At this time, I would like to remind everyone, in order to ask a question, please press *1 on your telephone keypad. We'll pause for just a moment to compile the Q&A roster. First question comes from the line of Jeremy Olson from Star Tribune. Your line is now open.
Yeah, hi. I just wanted to get a little more reaction from you about the CDC guidance.
Do you view it as good news, or does it worry you that it could interfere with kind of the underlying public health messaging at a time when you have these increase in B117 cases?
Well, I think this is Jan. I would say that it's always a balance. I think that the vaccination science that continues to grow is good news. And the fact that CDC has an eye on these data and is updating guidance as more information comes in is just part of that forward progress. But we do absolutely need to keep both of these contradictory trends in mind at the same time. The fact that the vaccines are such a hopeful sign, and that we still have to be very, very mindful of the variants circulating around there. But the guidance is quite specific on limiting interactions and being very mindful of the vaccination status of those we're interacting with. So, Chris, I don't know if you'd have anything else to add.
Yeah, I'll just add to that while we're delighted and we're celebrating, the number of Minnesotans who've been vaccinated, when we look at the number of Minnesotans who've actually received both doses of vaccine, it's just over 10% of our population. So this is good news, and it's clear motivation for us to take advantage of the vaccination opportunities when we get them. But I think it's important to realize that we are not at a place in Minnesota where this guidance really impacts many people. And so it's important that it's not about when vaccination is happening in your state. It's about when you have completed the complete series of either 2 doses of Pfizer or Moderna or 1 dose of Johnson & Johnson, and it's been at least 2 weeks. So just to kind of be specific about, it's great news. It's something to be hopeful about, but we're only at 10% vaccination in Minnesota. So this does not impact very many people right now.
As a quick follow-up, I mean, who's been vaccinated in Minnesota and who's been fully vaccinated, meaning it's been 2 weeks later, are 2 different numbers. Do we have a rough estimate of the fully vaccinated population? It must be something less than the numbers we have on your website right now.
That's true. That would be, we'd have to look at the data, from 2 weeks ago as to who was fully vaccinated as of that time, which we could certainly go back and look at that. That's a good point.
Right.
Okay, I'll take a look. Thank you.
Your next question comes from the line of Catherine Richards from Minnesota Public Radio. Your line is now open.
Hi. So it looks like based on the numbers, we're going to hit that 70% of people 65 and older within the next couple of days. Do you anticipate opening up vaccinations to that next priority group, like immediately? And I mean, when do you anticipate that happening?
Well, yes, Catherine, it is really encouraging that we're making even faster progress than we had forecast. So that we are definitely looking at kind of where we are when we expect to hit that number, and have been encouraging our vaccination partners as we've been in dialogue with them to begin planning for the next phases to come more quickly.
And can you just describe what that might look like? Now people can get vaccines at pharmacies, they can get them through their providers or local public health. How will someone, for instance, who has one of those underlying conditions get a vaccine, especially if they're going to maybe a pharmacy where there's no medical record, for instance, of that underlying vaccine? Will they have to prove it somehow? And also, how will food processing workers get connected with vaccines?
Great question. As we move forward into additional groups being eligible, we would envision, we talked a lot about this robust ecosystem we have with multiple different vaccination channels, that being really a strength for Minnesota as we get into situations where we've got more supply and the need to get a lot of people vaccinated simultaneously. I think for each group, there'll be sort of a logical main vaccination source. For people with underlying conditions, we do expect that will primarily be their healthcare provider. especially in this first group of folks with a very specific list of high-risk conditions. Those are folks quite well connected with the usual source of care. So for most people, as is true for many of us, who've been called by our providers by virtue of being in age categories, you can expect to hear from your primary health care provider if you have that relationship. But yes, people with underlying conditions could seek out a community pharmacy, but that we don't expect that will be the main route, as opposed to some of these groups of workforce sectors as we get into those, or education and childcare workers now can look to community pharmacies under the federal retail pharmacy program. You probably remember President Biden last week encouraging community pharmacies to vaccinate education and childcare. So for each group, whether it's through the vaccine connector or through other communication channels, people can expect to get some more tailored information that applies to their group as to where they can expect to get vaccinated. We know some food processing plants are interested in having vaccination clinics right on site. That will certainly depend on each individual employer. But it will be a mix of opportunities.
Okay, thank you.
Your next question comes from the line of Joey Peters from Sahan Journal. Your line is now open.
Hi, thank you. This is a question about something I've been hearing some confusion about from some people, and that's for patients 65 and older, does the state require them to show an ID when they're getting vaccinated? And if so, does it have to be any specific type of ID, like a photo ID or a government issued ID?
Well, we have asked for identification at the state sites, and I think Chris can speak to guidance given to pharmacies. But yes, we ask people to show proof of age generally, but I don't believe we've been specific as to the type of ID. But Chris, do you have something more specific?
Certainly, in the connector, we ask people to state their age, and that's a way that partners who may not be familiar with the patients can check to make sure that they are eligible, is something to indicate their age. But it's not intended to be a barrier for vaccination. Just to help to make sure that we are, that people are aware that, that there are some guidelines that we're asking them to follow.
Got it, thank you.
Your next question comes from the line of Jennifer Hoff from KARE 11. Your line is now open.
Hi, thank you. I was just wondering, there is also some recommendation to Carver County and maybe even other counties to consider now taking a pause when it comes to their youth sports. What would you say to the organizations that don't plan to do that, or who feel very, as I've heard from organizations, fired up about this, that maybe they feel Carver County is being singled out, and since it's a recommendation and not necessarily a hard and fast rule at this point, I just wondered if you would have some advice or repeat some of the stuff that you said that you would say to them who are maybe not planning to follow this pause.
Well, I think we wanted to make that recommendation because we really want people to be aware of the significance of these variants, and the B117 variant in particular circulating, and the fact that this is a significant number of cases that have emerged quite quickly. And what we know from other data in other countries and states is that B117 is easier to transmit, it spreads more quickly, and it really requires additional vigilance to get on top of outbreaks like this when we see them begin to happen in our state. And we have done very careful epidemiological analysis of the cluster rosters in Carver and believe that we have a high degree of certainty about the linkage between cases. So we want people to be aware of the situation and to really consider not engaging in those activities at this point in time. You're right. It was a suggestion, a recommendation, but we certainly encourage, if people are going to go ahead and continue to participate in youth sports, that they are just extra vigilant on maintaining the other precautions. Distancing, mask wearing, avoidance of some of the social activities that often accompany games. Just really need people to be aware that this is an elevated risk situation, and they should take individual precautions if not a community decision to suspend these activities.
And Commissioner, I'll just add to that. We're talking about a population that does not have access to vaccine. The current vaccines, the Johnson & Johnson and Moderna, are for individuals 18 and older. Pfizer can go down to 16, but in general, these are populations that won't have the ability to get vaccinated in the short term. And our concern is that ongoing transmission in this population will allow B117 as a variant to spread quickly across the state, as well as high levels of transmission could allow for the emergence of other variants. And so that's why we think it's so important that people are really taking this seriously. Thank you.
Your next question comes from the line of Jeremy Olson from Star Tribune. Your line is now open.
Oh, great. With regard to those Carver County sports-related cases, has your investigations determined whether there were cases where everything was done right and they still got infected anyway, or were there cases where people were playing without masks or going to parties in close contact? I was wondering whether it was the case where everyone did everything right and got infected anyway, or something else.
Chris, do you have any additional insight you can shed on the investigation, the individual case investigation findings? I can't really comment on that in general.
We know that there were additional activities that were associated with sports. So in other words, there may have been attention to masking and things during a competition, but also were additional activities in which that didn't happen. And so it's kind of challenging to tease out.
Also, Commissioner, I wanted to ask you about this next group, priority group for vaccine. It's a small group, less than 100,000 people. You had said a week or so ago that it might be weeks to get through that group. Do you have any finer estimate on, could it be a week? Could it be, how much time would it take to get through a relatively small group in the priority?
Yes, we are. We do think that in the case of the folks with those specific high-risk conditions, again, under the assumption that they are connected to sources of healthcare, and those healthcare providers are looking at their patient rosters and able to make outreach and get folks in quickly through appointments, it could go quite quickly. It could go less than a couple of weeks. And that would be our hope, frankly. These folks have been really anxious to get vaccine. We know they're highly motivated to get in. Their providers are eager to serve them. So we think that group will be taken care of and should be in quite a prompt way as we also start working on the food processing sector at the same time.
And at the risk of being greedy, can I quick ask, have you defined the remaining 30% or so of seniors? Are they just seniors who have been waiting patiently and now they're getting their turn? Or are there people, a certain subpopulations who haven't been interested? I'm just wondering, who are the remaining 30%? Are there any challenges getting the remaining doses to the remaining seniors?
That's a great question, and we always know that it will be something less than 100% of any group that chooses to get the vaccine. We've seen some regional variations, and we've worked this week particularly to make sure that that the supply of vaccine is responsive to where there is still demand that hasn't been yet fulfilled. But we do think we might be approaching the point where either folks just preferred not to get the vaccine right away. I certainly have friends who have felt, and myself, who felt that wasn't urgent to get a vaccine quickly. Wanted to make sure that people with higher need got it first. So I think there are a number of people out there that fully intend to get vaccinated, and as they are more confident that others who need it are getting it, we expect those numbers will continue to move up, and will be certainly. I mean, one really important thing that we want to just keep on emphasizing is, even as we open up to additional populations who are eligible, the groups that have been previously eligible will remain a priority. So any remaining 65 plus folks, or any remaining healthcare workers, or folks with underlying conditions, as we move on through those tiers, you'll stay eligible. So if you were out of the state, or just didn't make it a priority, or wanted to get more information, you will remain eligible, and you'll remain a priority. So when you do want to get vaccinated, those who have the vaccine will prioritize getting it to those groups that are currently eligible.
And Commissioner, I'll just add too that I think there's a number of people who are getting vaccinated out of state, snowbirds and things like that. And while we do have reciprocity for data sharing with partners like North Dakota and Wisconsin to get information on who's vaccinated, we don't necessarily have that for Florida or Arizona. So we anticipate that there are additional folks who've been I know my dad is one of them who've been vaccinated out of state, but won't show up on our numbers at this point.
Thank you.
Operator, we have time for one more question.
Great. Your next question comes from the line of Catherine Richards from Minnesota Public Radio. Your line is now open.
Woohoo, it's super here. Okay, so I want to go back to what we're seeing at all of these pharmacies around the state, which sort of seem to have like an immense number of appointments starting late last week and over the weekend. What is your guidance here for slots that aren't getting filled as we've reached that saturation point? I know people have written me who are qualified sort of in that next priority group, who've been able to get one at the end of the day. Are doses getting thrown away? I mean, what do you know about what's going on there? And what are you sort of advising the pharmacies to do if they have extra appointments to get people in, and who they should be targeting to get people in?
I think that's exactly why, I think the governor indicated from the beginning that we would be watching this closely and not looking at like a hard and fast day and number, but as we start to observe the very phenomena that you're describing, with open appointments and not as many people, filling those appointments within moments of them being offered, that signals that it would be a good thing to open up more flexibility so that pharmacies and other providers would be able to serve those folks next in line, so to speak. We definitely have encouraged all providers to make full use of their doses. To certainly, first of all, to try to find currently eligible or previously eligible populations to take up those doses. But we certainly are aware and have been fine with providers using those doses for folks who are right there and in need. But that is very much kind of influencing how we want to approach these next tiers and moving. We're just delighted that things are going well, that volumes are starting to open and more people are able to access vaccine, closer to their communities. That's been the whole goal.
But I do want to emphasize that the doses are not getting wasted. So to be clear, their doses are not getting wasted, and the only time that you have a 6-hour limit is when you've reconstituted a vial of Pfizer vaccine and you have to finish those 5 doses within 6 hours. But for most of our pharmacy providers, or many of them, they are using Moderna, and so if they don't need to use the doses, they will just be available the next day. So just to be clear, we're not seeing a wasting of doses.
Okay, and if I can be greedy too, I'm going to ask one more question on behalf of my colleague, Peter Cox. He wants to know if this new CDC guidance might change anything in terms of visitation rules for long-term care.
Well, we await guidance from the Centers for Medicare and Medicaid Services on skilled nursing facilities in particular. They are the ones that set that guidance, and then we adopt it in Minnesota, and we typically use that as a framework for our guidance to assisted living. So, Chris, I don't know if you've heard anything on that front, but there usually is some relationship to what CDC is doing with what Health and Human Services, CMS, follows with.
Right, and we reached out to CMS because we're equally eager, and they indicated that they had not changed their guidance at this point. I think one thing to keep in mind is that this information from CDC is for individuals who are vaccinated. Not everyone in these facilities has chosen to be vaccinated, so that's a consideration. And I do think that CMS is probably taking a fairly conservative approach. We'll wait for their guidance, but I do know that because of the vulnerability of this population, they're being very cautious, obviously because of what we saw with disease transmission and death earlier.
Okay, thank you.
All right, that is all the time we have for today. We invite any reporters with additional questions to reach out to our office this afternoon. Have a good day, and we will talk with you again soon.